Welcome to Innovative Community Engagement through the Master Health Volunteer Program. I'm Dr. Katie Zaman, and I'm a Health and Wellness Coordinator in the Office of Health Equity and Community Engagement at Utah State University. My co-presenters today are Dr. Sandra Sulzer, Assistant Professor of Health and Wellness and the Director of the Office of Health Equity and Community Engagement. Dr. Stacy MacArthur is an Extension Associate Professor in the Utah State 4-H office, and she's a state volunteer and health and wellness specialist. Suzanne Prevedel is an Extension Associate Professor in the Home and Community Department, and she is the Director of the Tribal Opioid Resource Center. Claire Warnick is my fellow program coordinator in the Office of Health Equity and Community Engagement, and she's been coordinating the Master Health Volunteer Program since its inception. The Master Health Volunteer Program helps us to grow our community's capacity to work on solving their own problems. It was designed to facilitate volunteer engagement in communities across Utah. We worked with Extension faculty to develop the content along the model of the Master Gardener Program, as well as the Well-Connected Communities Initiative through the National 4-H and Robert Woods Johnson Foundation, which focuses on grassroots level changes and empowering communities to make those changes that will be effective for their communities by engaging with local resources and leaders. The way that MHVP has been designed is to try to harness the knowledge that community members already have and to provide them with evidence-based knowledge to guide their activities while connecting them with resources. Utah State University Extension provides research-based programs and resources with the goal of improving the lives of individuals, families, and communities throughout Utah. USU Extension operates through a cooperative agreement between the United States Department of Agriculture, Utah State University, and county governments. The Master Health Volunteer Program has three main goals. First, we want to increase volunteerism in local Utah communities. We want to increase community engagement in health and wellness issues. And lastly, we want to increase community access to evidence-based information through online learning. There are two basic parts to the program. The first part is an online curriculum that covers various health and wellness topics. As volunteers go through this program, they are asked to meet individually with a faculty mentor to discuss the curriculum content and to get help in developing their projects. The second half of the program is to implement the project and carry it out. The total time commitment is about 80 hours, half of it being the volunteer project itself. This may seem like a long time, but it's really only an hour and a half each week. That's less than the 2 hours and 46 minutes on average that Americans spend watching TV every day. The curriculum is modeled on the SAMHSA Wellness Wheel, and it takes a holistic approach. Some volunteers are more interested in the physical health aspects, while others are more excited about other health areas. This broad approach allows them to marry their personal interests with their community work. This is a comprehensive curriculum. The program doesn't require faculty to have expertise in all of these areas personally, but faculty can support volunteers as they work through the curriculum. The volunteer project is the meat of the program, and it's flexible. Volunteers can design the project based on their own interests, but in a way that meets the needs of the community. And this is where the mentors can help to channel those ideas into areas that would make an impact. We know that the number one constraint that volunteers face is time. For this reason, we give volunteers up to an entire year to implement their projects. The program has been running for a year and a half, and we recently did a cohort-style pilot where a group of volunteers went through the curriculum together. We came up with this idea while working with our tribal partners who voiced a preference for face-to-face or virtual group activities. Cohorts met weekly on Zoom for 12 weeks to review the material in each of the modules and to discuss their ideas for their projects. Volunteers were able to delve into topics that they were interested in and share their knowledge and ideas. The idea was to provide support for volunteers as they went through the modules. We would talk about the module and what they learned and if they had any questions. We developed a physical workbook organized by modules with all of the activities and worksheets. The initial idea of the cohort model was to offer support. We realized that not everyone in the community has experience working on online modules, and we learned that the support was needed. People didn't necessarily have prior experience with this type of learning. We have videos of the cohort sessions posted on our YouTube channel, and we invite you to check them out. We found many benefits to the cohort model. Participants got to know each other during our weekly sessions and developed camaraderie. They made connections with community members. The sessions allowed a safe space for people to share what they had learned and connect it to their real-life experiences. We also were able to identify areas for curriculum improvement and discuss those ideas with the participants. This program helps individuals balance themselves and learn about their own health and wellness before moving on to community projects. We were able to go deeper into some of the topics and develop connections between the material and people's lives. The cohort model allowed us to help volunteers think about feasible projects, and we worked closely with them to make sure that they completed their curriculum in a timely manner. It helped us keep people on track. Let's talk about program impacts. In our initial pilot phase, 6 rural community members participated. All of them reported increased knowledge about health and wellness after completing the curriculum. One volunteer received a $1,000 award from the Utah Public Health Association to support her project. During our cohort pilot phase, 10 volunteers from the Ute Indian Tribe Painted Horse Diabetes Prevention Program participated. These participants also demonstrated increased knowledge about health and wellness after completing the curriculum. To date, over 480 volunteer hours have been returned to local communities with an estimated value of $12,576. Thank you so much for attending our presentation on the Master Health Volunteer Program. We would really appreciate it if you would take a few moments to complete this brief survey about the session. We would love to hear from you. If you have any questions or comments, please feel free to reach out to the emails that are presented on the screen. You can also find out more about the Master Health Volunteer Program on our website. We would love to work with you to implement this project in your own communities. Thank you.